Hi, thank you so much for joining us. I am Dr. Jill Wener. I'm a meditation and tapping expert and anti-racism seeker and an enthusiast, and someone that is always trying to work to expand my own knowledge and understanding of racism in this country. And I'm doing a series on healthcare disparities in COVID. And I have Dr. Sara Silvestri here, who is a pediatrician and works at a federally qualified healthcare center. I may have said that wrong, so you can correct me. And Sara, if you could introduce yourself and tell us more about what it is that you do on a day-to-day basis, what your overall passions are in terms of healthcare disparity, and we'll go from there.
So yes, my name is Sara Silvestri, and I am a general pediatrician. I'm also the medical director of a federally qualified health center outside of Pittsburgh. We have 2 sites and serve a largely underserved minority population. My interest in health disparity started when I really started at this FQHC. I've done many different areas of pediatrics and healthcare during my career, and came to an FQHC about 3 years ago and became a medical director a year after that. So I've been medical director just a little over 2 years. We serve a patient population that is largely at or below the poverty level, and have a lot of social impacts on their health. And with this experience, it has really opened my mind to how minorities are affected by diseases, chronic diseases, as well as now COVID.
Great. Well, thank you so much for the work that you do and for agreeing to be interviewed today.
My pleasure.
So can you tell me a little bit, like pre-COVID, what did you notice about how healthcare disparities and just general systemic racism has affected your patient population, and what are some of the issues that you noticed even before COVID brought a lot of this to light?
Sure. Well, pre-COVID in the FQHC circles and outside of that, the term social determinants of health have been a key term in that sort of public health arena for at least a year, if not a couple years now. And what that refers to is exactly what it sounds like. It's those social aspects that help to determine somebody's health. So do they have stable housing? Do they have food security issues? Are they able to have access to doctors and hospitals, and can they get their medication at the pharmacy? All of these aspects help determine how healthy somebody is going to be. It's not just genetics and their ability to pick up a disease or to fight off a disease. And so from the pre-COVID years, that's really where FQHC work and public health has been focusing their interests, trying to help overcome these barriers for these patients who may struggle in different social aspects to help improve their health overall. So that it's been something that we've been dealing with and discussing and working on for years, and especially again that social determinants of health term has been very popular over the last year or two. Now COVID obviously is bringing to light some of those disparities that we see in that more vulnerable population, and putting it on a bigger stage.
Okay, that's so helpful and so well explained. What are some of the biggest barriers do you think that you face as a clinic, as a healthcare provider? What are some of the biggest challenges you and your organization have faced trying to correct some of these or improve some of these social determinants of health?
Yeah, we go to medical school and we're taught how to take care of high blood pressure and diabetes. And, as a pediatrician, we do strep throat and colds all the time. And that's what we're taught in medical school. And then you can get out into the real world and you meet these patients who okay, I can tell you what to do, but can you follow my instructions? What is coming in between your health and what I'm telling you to do? And the number of barriers that they have is just mind-blowing at times. And each one you have to kind of take little by little. And so as a health center, we are trying to treat the whole person, trying to treat all the challenges they may have. But every day it's a new challenge, and we learn each day what could possibly come up for people. So we found everybody assumed at one point that transportation was an issue. People could not get transportation to the hospital, to our office, to the pharmacy, to get their medicines. And for a long time, we had that assumption that that was one of our main challenges. And it is a challenge for our patients, but in our patients' mind, it's a lower challenge. And so we've done a lot of focusing on speaking to our patients and trying to understand from their side what their challenges are. We can assume what their challenges are, but our assumptions are not always correct, is what we've learned. And listening to patients, those challenges change on an hour-to-hour basis sometimes. It's not uncommon that we'll have families call for an appointment in the morning. We give them an afternoon appointment, and 2 or 3 new things come up between the time that they've called and the time of the appointment that they can't make their appointment. And those challenges have to take precedent in their life. If they have the opportunity to go and work and make a little bit of money, they're going to do that as opposed to come in for their diabetes recheck. If they have to choose between going and getting food for a week versus picking up their medicine, they're going to feed their families. So it's an ever-evolving list of challenges, and it changes day by day for each patient, which makes our job difficult and challenging because, as I mentioned, we were trained on medicine. We're social workers. We're not necessarily trained to think about all of these other aspects that happen when somebody leaves our office. And so that's where we've worked in the last several years to try to bring mindfulness to our staff about these challenges and help to create pathways that we can help patients negotiate and navigate that area.
That's such an important point you bring up about, we as doctors, we as people who are maybe not in underserved areas, have had a lot of privileges in our life growing up, regardless of our race, but certainly like I myself as a white woman, like tons of privilege. Not even, and so that translates to the whole system, not even having a sense of how to fathom what it is that our patients go through before they come in and once they leave. Mm-hmm. And then also assuming that we know what they need instead of asking them what they need and figuring out how we can help. So I think that's such an important point that you brought up. And I think a big problem, and a lot of this, I've seen some articles, donating 10,000 pizzas or 1,000 pizzas to a hospital. They're like, we really need pizza right now. That's not the problem. Yes. So it's really, really knowing that, trying not to be paternalistic about it, but really, really listening to what your population needs. And you're someone who's seeing these people on a daily basis. So how do you think COVID, because there's been, for anyone who hasn't heard of this data, there's been pretty incredible statistics that have come out pretty recently, shockingly recently, about disparities in outcomes for Black patients. And this was as of late last week. In St. Louis, all deaths were from COVID from Black people. In Louisiana, 70% of the deaths were in Black patients. Milwaukee, Chicago, so many places. There's so much a higher risk of death in Black populations, and we've all been kind of buried in our little bubbles of survival mode right now, of trying to get through the day and figuring out our own family's situation. Do you have a sense of why this data had not been reported? Can you conjecture that at all? What took so long for it to be reported, and how that's changed the face of COVID right now?
Yeah, anything Any idea as to why it took long would be conjecture. I will say, to preface though, I'm not surprised to some extent by this data. The minority populations, and in particular African Americans, are harder hit by most diseases that we talk about for those reasons, those social determinants, as well as I'm sure there's some biological differences too. I can speak to my own patient population right now. For us, simply getting our patients tested has been a challenge. I'm sure that when data is released, when this is all done, be it a year from now, 2 years from now, 10 years from now, whatever, we're really going back and looking and saying, how did COVID affect the world? How did COVID affect this population? How did it affect that population? What was the total healthcare cost of COVID? Our data is going to be skewed. My patients, and in the area that I practice at, there's about half a dozen FQHCs in a relatively small area. In between us, we serve, somewhere between around 75,000 patients, most of which are going to be, again, poverty level or below, with a good portion of those being minority patients, mainly in our area, African American, less Hispanic, less Asian. For us, as that big group, currently we have almost nowhere to send our patients to get COVID tested. Where we are practicing, there are several large healthcare systems, and then we have, of course, commercial labs such as Quest or LabCorp. And our local large healthcare systems have made it so that they have testing. Their testing has ramped up. As a area overall, we've increased testing, but those large hospital systems are making it so that a patient has to have an order from one of their physicians in order to get testing done. They've said that, for somebody like me who is not part of their healthcare system, I can refer them to somebody at their healthcare system for a telemedicine visit. That physician would then determine if that patient qualifies for testing, write the order for the test, and then the patient could go to their healthcare system to get the test done. That's a lot of steps needed to get my patient tested. That also brings up copays. It brings up transportation. It brings up that accessibility. And those are not easy barriers for our families to navigate and to overcome.
And then have to do it 3 times for you, for the doctor, and then the other.
Yeah, and then actually get the test. Yeah. It's a multi-step process. The commercial labs, we did get a very small handful of tests from Quest at one point, and that was a month ago. They told us flat out they cannot replenish our tests. Our other big supplier of commercial testing never actually supplied the test. And I understand that that's a problem across the board. So I don't think that's unique to us. Yeah. But talking about this group of patients who are vulnerable, who are generally not well represented in these type of studies as we go on and talk about numbers, my gut is that these type of reasons are probably why some of this data was lacking. Mm-hmm. I believe our data locally does not reflect my patient population.
Yeah.
Well, I know it does not reflect my patient population well. I can't get them tested. So they're not going to be tested. They're not going to show as having had COVID or, being a COVID positive person until they're hospitalized or worse.
Yeah. So when you're educating your patients come in with adults or someone older than them, maybe not like their parent, but sure, somebody is bringing them in. Mm-hmm. How are you educating them about social distancing, shelter in place, and what sorts of realities are you seeing? Because for me, yes, I can do the majority of my work from home. I don't practice medicine mm-hmm. anymore. And there's lots of people, affluent, privileged people, who can't have the privilege of doing that. A lot of people, I would think that in the clinic, in the area that you serve, don't have the there are many reasons why they aren't able to just like stay home and work from their little computers and Zoom meetings like me. So,
Yeah.
so what's some of the pushback you're getting? How have you adapted your advice? What are some of the like realities that you're seeing on the ground of what people are going through?
Well, an important phrase you used earlier, and we do all feel it, we're all in survival mode right now. Everybody is just trying to survive. And I think it's very different for some of us versus others. You know, survival mode, from what I'm hearing from my friends, from my colleagues. Oh, we're all trying to work at home and educate our children at the same time. And our spouse is also working from home, and it's chaos. And it is. I mean, don't get me wrong. It's very difficult to be a stay-at-home mom and a teacher and a full-time employee all at the same time. I don't discredit that at all. We all have our challenges. But survival mode for our patients, especially my group of patients right now, they're always in survival mode. They have a tendency to live in survival mode. You know, when this came out a month ago, and we said, well, okay, we're going to shelter in place and people shouldn't leave their house for 2 weeks, and we're going to take it 2 weeks at a time and see what's happening. It was easy enough. I could go out to the grocery store and stock up a little bit and say, okay, well, I have pretty much what we need for 2 weeks, and we can't leave the house, we'll be okay. My patients can't do that. They don't have a 2-week reserve financially to go to the grocery store. They don't have a car to get to the grocery store and buy a 2-week supply. If they're walking to the grocery store, they're going to bring 3 or 4 bags home. They're not going to bring a trunk full home of groceries. So from that aspect by itself, they can't shelter in place the way a lot of us can. Their simple basic needs, they're going to have to go more often to replenish what they need, to get what they need. There's also the aspect of how they're going to get there. So again, if they walk, that's great. That's still social distancing. If they have a car, that's a minority of my patients. They can drive. A lot of them, though, are taking public transportation. The public transportation is still running. It's necessary for people, but it's not social distancing. So this is going to go to, I think that previous question you had as to, you know, talking about some of those numbers and how the minority population may be greater affected. Some of them are going to have higher exposure risks because of this. They are also more likely to be the essential employees. You know, a doctor or a nurse is essential. A medical assistant is essential. Our radiology techs are essential. A lot of healthcare providers are not making large salaries and are still essential employees. They're also, you know, our patients are the grocery store workers, the fast food workers, the people who are also still essential and still going to work. So again, they don't have that opportunity to really hunker down and shelter in place as well as some other people do. And lastly, we're looking at families that some are multi-generational. For many of us, we're trying to keep the kids away from the grandparents. A lot of these homes don't have that possibility. We also have, you know, single moms who have numerous kids. This has created a childcare issue for them if they still have to go out and work, and now daycares are closed. They don't have anywhere to take their kids. They're taking them to the grandparents again or to somebody else, and that's not social distancing. And then, you know, God forbid mom gets sick. She can't quarantine herself away from her 5 kids. She still has to come home and do what she can. So social distancing is really a challenge for a lot of people. And, you know, what we're recommending, we explain what social distancing is, we do our best, but we have to be realistic too. I can't ask mom to stay away from her 5 kids. I can't, you know, if they have to run to the grocery store every 3 days because they can only carry, they're 70 years old and they can only carry 1 bag at a time and they don't have anybody to help them, I can't tell them not to go. You know, we're doing what we can as an organization. We have put some procedures in place where we're delivering formula for families who need it. We've delivered toilet paper to people who need it. We have shaving supplies and different sanitary supplies. We're doing what we can to help keep these people at home and help them shelter the way they're supposed to. But a blanket statement of don't leave your house for 2 weeks and try to stay away from everybody is not really realistic for a lot of our families.
And then judging them for not being able to,
Mm-hmm.
not
Yes,
understanding
yeah.
that it's not even an option in a lot of cases. Now, I know that domestic violence that transcends all classes and incomes, and there's certainly affluent, privileged people who are at home and being, mistreated and have substance abuse issues. Does your population see a higher percentage of that? And are you seeing issues with safety at home as well?
No, I think that's
COVID, what were the statistics such that your patients were at any higher risk of that?
We certainly have a lot more CYF involvement with our families, child youth involvement, than maybe some other offices do. Not necessarily all from abuse, but from, maybe unsafe living situations, unsafe housing, that kind of thing. So I think some of that is at a higher risk to begin with. Certainly with COVID, it's stressful. We're all feeling that stress. That's again transcending all different classes, where everybody feels it's a little more stressful. And unfortunately, we know that stress does make violence higher. The hard part is, since a lot of us have moved to doing more telemedicine visits, we're not bringing families in as much. It's a little harder to screen for that right now. We know that our local children and youth is not as readily going into homes or following up on things as easily. There's some telecommuting. That makes it tough. It really does make it tough to know what's going on in homes right now and worrying about increasing violence for spouses, for partners, for children.
There's so many levels of this that are so just overwhelming. And, there's so many things right now that are unfathomable, and, unprecedented word gets thrown around a lot, but it's really every step you can look at, there's layers and layers and layers of how this affects people. What do you feel like people can do who are maybe already were very aware of these issues, or now are becoming more aware of them, who want to do something to help, but are stuck at home, stuck in their own bubble of their version of survival mode? What can people do to help? It's going to actually be helpful and not just make them feel like they're being helpful, but that's going to actually help. Is there anything that can be done right now, or is this more looking towards the future when we can all go out into the world again? What are your thoughts on that?
There's both. This is a great time for some self-reflection and figuring out who we want to be after this. I'm hoping that a lot of people are a little more grateful and a little more living in the moment, shall we say, mindful, as we would say in meditation. This is a great exercise to really know that when we come out on the other side, we do need to be more grateful and more mindful. We're going to have, hopefully, a little bit of a different attitude about everyday life after this. And I think some of that does need to help us open our eyes to what's going on with the world around us. Everybody is so busy in everyday life. A lot of us have that mindset of, I just gotta get this done, I gotta get this done, I gotta get that done. Now that we can step back a little bit, hopefully we can broaden our view. That's in the long term, obviously. Just knowing what's out there, knowing how other people are affected by life, what other challenges people have. Being educated is an important part of that. In the right now moment, the organizations that have always been there are still there and are still trying to work really hard to get information, education, goods out to the people who need it. So if somebody's looking for a way to help right now, I would say the best would be to look at what organizations and agencies were there before. Those agencies know what they're doing. They're already ingrained in communities. They have resources and personnel who know how to navigate these type of situations. They probably need some help getting the goods. They may need financial donations. Everything is more expensive now, so their money is going to not be able to provide as much as it used to. They could use, again, actual donations of physical goods to get to people who need. So, you know, if somebody does have extra of something, toilet paper or sanitary products or formula, getting it to somebody who can distribute it is very helpful. But we don't have to reinvent the wheel. There are always organizations out there to help. They're still working. We just need to connect the people to them on both sides.
That's really great. So are there organizations near you that you recommend? I think a lot of people may not know like how to even find these organizations. Are there some that are national ones that people could look up near them, or what are some of the things people could look for? Those are great ideas, so money and physical goods, but like, who do they Google? How can they find ways that bring it to these people?
Yeah, you know, I'll be honest, our local organizations, a lot of the ones that we work with as an FQHC are smaller. But food banks in general, if you can Google food banks, it can give you a nice idea of who's local. And in doing that, that'll sometimes, you can fall down one of those internet rabbit holes and find some other people who are doing similar work. So, for instance, we have an organization called 412 Food Rescue in our area, and they, if you look up food banks, they have a tendency to come up also. And so in that way, you can try to connect to your local community. United Way is a wonderful way to get some local organizations. I believe the 211 is a national information number. It is at least where we're at. And if you dial that, it helps to connect people to whatever needs they have. And they are able to really say, oh, okay, you know, if you're interested in a specific area of, you know, let's talk about food. They can give you a list of people who can provide food, and then you could call them directly. So United Way is a great way to get it connected to local organizations through a more broad national organization.
That's really, really great. That's so helpful. And could they Google like FQHC for the federally qualified health centers near them and call them and ask for resources? Is that another way too? I would assume that all the FQHCs are pretty plugged into their own communities.
Yes. Yeah. This is the work we do every day. So most FQHCs do have a good support system around them of different organizations that can help provide for their families. So if anybody is interested in just getting an understanding of what's around them and how they could help, your local community health center or federally qualified health center most likely has somebody there who could give you a very broad list of helpful organizations for those in need.
That's such a great list. Thank you so much. How are you doing? How are you and your family holding up right now in all of this? And how has it affected your practice, your medical practice?
Yeah, the family's doing well. We're all getting used to being together a little more often. It's it is a change for everybody and a challenge. My husband is now working from home. He started working from home before I did. We have a son who will be 3 next month, and his daycare has closed, obviously. So we're juggling how to be working employees and stay-at-home parents and potty training, since that has decided not to happen after the change. And all those, helping our son process what's going on too is a challenge.
Right, yeah.
An organization, we have moved to mainly telemedicine visits. And we're seeing what I think everybody's seeing right now: emergency rooms, urgent cares, hospitals. Everybody's numbers are a little down right now, aside from maybe, hotspots like New York City and that type of thing. there's a general sense that you don't want to leave your home and you don't want to get exposed if you don't have to. And going to some place where other people may have it, a doctor's office, a hospital, an emergency room, is just not something people want to do, understandably.
Right, yeah.
There, our numbers are down. The concerning part is that, the chronic diseases didn't go away. So I worry about our patients who do have more brittle chronic diseases and where they're going. I won't by any means say that every emergency visit was necessary before this. As somebody who used to work in an emergency department, I know every emergency room visit before this was not absolutely necessary. But I've heard ER visits have decreased 75%.
Wow.
I can't, that's just amazing to me. That can't possibly be good for a lot of people. That means there are still a lot of sick people staying at home who do need healthcare and who need to be seen.
For people, I know that you do some work outside of your direct pediatric work. Do you want to share a little bit about what you do and how people can contact you if they want to learn more about working with you or learning from you?
Yeah, so there's a few different things that I do. With my work at the FQHC, I do meditation and yoga training. So that's something that you can, if you're interested, you can look at the health center itself, and that's Stowe Rocks Family Health Center, and that's in McKees Rocks, Pennsylvania. We will be hopefully doing some meditation sessions online to help our families through this stressful time frame. In addition to that, I also am the founder of a company called the Adoption Doc, and through that, I help families negotiate the medical aspects of adoption. My son is adopted. We are adopted parents. Mm-hmm. And while we were going through that process, there were a lot of different medical questions that came up that in the process, we just sort of ran through. And it wasn't until after where I sat down and was really thinking about it that it was easy for me to navigate whether I was willing to accept a situation where a baby may have been exposed to something or not. But I realized for the general population, those are not issues that they may have easy answers to. And so through my company, the Adoption Doc, I hope to help families navigate those aspects a little better.
That's such a needed service. Thank you for that. I will include all of your links to all your websites and information about you in the information for this. This will be posted on YouTube. Thank you so much, Dr. Sara Silvestri, for joining and for your insight and your the work that you do even before COVID and the work you're doing now and for everything you're doing to help raise people's awareness about the realities that are day-to-day, now even worsened for your patients and for their families. So thank you so much for joining.
Oh, thank you for having me.